My name is Daphne Hart. I'm a family physician living in Smithers, and I have a contract with Northern Health to help people living with HIV access medical care. My priority has been, first of all, when I came back from taking the course at St. Paul's, to help people realize that they don't have to die from HIV. It was 10 years ago, and there were still people who didn't understand that. And then, as time went on and I realized that HIV wasn't the biggest problem in some people's lives, then the question is, how do you help them with the biggest problems they have so that they can actually deal with the HIV? So my particular interest has been in helping people get access to care and to make sure that the care that they accessed was standardized, high-quality medical care, and that there was support for people to be adherent to treatment. That's really what my thing has been about. I haven't had as much to do with testing. I realize the importance of it, but it's not what my particular role has been. You know, most of the people living with HIV that I've been associated with have requested a test. There have been some people who've been tested, say when they're incarcerated, and occasionally a person will come into the emergency department with a sort of a slightly vague symptom, and a physician will think to order the test. So it's been a variety of ways, but in fact most of the people have requested a test. Oh, I think it's a pretty traumatic and dramatic reality. I think there's a lot of fear. Sometimes it gets to be about being angry at themselves and the world, but a lot of sadness, sort of distancing. And then, you know, there's the odd person who can sort of flow with it, but it's tough. I think, as it happens, I'm not usually the first person to tell them because they've been referred to me when they already are living positive. But the thing that I like to make sure that they do understand is that they do not have to die of HIV, and that HIV is a chronic manageable illness, and that there is help. I think that they do. I think that it's explained at the beginning and in the middle and by everybody they talk to, you know, the specialist, the pharmacist, myself. I don't know that it's always remembered as clearly as I think it's been said. Oh, I mean, I think that's the same reasons that interfere with people's access to good quality medical care are the same reasons that are in their way of adhering to treatment, which, you know, could save their life in the long term. And it's all the other, you know, health and social problems that they live with. And I think it's about substance abuse or addiction. That's very big. Sometimes other mental health diagnoses, depression, housing, poverty, racism, all the things that you know, people have to deal with first, or sort of affect their feeling of self-esteem and their sort of right to be healthy.